everyone, today we're going to talk about the anatomy of this shadow, which is, I use green color of this shadow, which is just located posterior to our tibia here, and also I use another color. This will be the cargus fat pad, the yellow one, okay? And then we most of the time know that this is the gastrosoleus muscle, and then eventually we will have an Achilles tendon, which is well attached to the tuberosity of the calcaneus. But sometimes we just simply don't know what is the green area, right? Okay, so I will try to drill into the anatomical detail and give you some hints how you will actually know the concept and also this anatomical structure really well, okay? So let's start. Actually, we are dealing with this shadow. As you can see, it is a large muscle which is positioned posterior to the tibia, and you can see that there is a tendon arising from it, and it will hook as the posterior aspect and also inferior to the substantial talus, running a relatively straight path, okay? So actually, what is this? How can we ever differentiate it from all the other groups of muscle which is located also posteriorly? Because there are three possibilities that we always name them as Tom, Dick, and Harry, right? Okay, Tom, T, stand for tibialis posterior. Dick, Flexor digitorum longus. Harry, H, stand for Flexor Hallucis Longus. All three sounds possible, and actually, how can we differentiate that? I use an axial cut, and then you will understand. Okay. So basically, the Tom, Dick, and Harry, you can see that this is tibialis posterior, and this one, which is running just adjacent to T, will be Flexor digitorum longus, and actually they are running together, and there is separation between them and also our Flexor Hallucis longus, and between them we have the arterial and also venous and also nerve, okay, some neurovascular bundle separating them, okay. So basically we can conceptually divide these two into two separate entities. Okay, why? You may ask the question. Okay, firstly, these two are actually hooking around the medial malleolus and then goes to the foot, and then this one is actually hooking at a different position. Okay, so let's trace along that, and then you see it will firstly hook around a notch of posterior locating at the tibia like this. Okay, so this is the first point it will hook, and then eventually you will also see that it is hooking underneath the substantial talus. So actually it is relatively strict in the path. So that's why I just tell you that. Okay, so you can see at the sagittal plane, this is a relatively unique muscle because we use our big toe for standing and also walking a lot. This is a really essential one, okay? So it is having its own separate hooking mechanism around the ankle joints. So you will ask, okay, how about the other two? The other two, you see, they are running very close to each other, and it is hooking much more laterally, okay? Much more medially, I would say, okay, around the medial malleolus. However, if you now understand that, so basically, okay, so you now understand the key point, which is this muscle is actually hooking around more posteriorly as the talus as well as the substantial talar, and while the other two are more towards the medial aspect, so they do not contribute to the shadow posteriorly much. So you now have more deeper understanding after this ankle radiograph anatomy quiz, right? And hope this will be helpful For example, if you are going to take your anatomy examination and you feel very frustrated regarding the musculoskeletal anatomy, or you may be an orthopedic doctor and you may not even know how to apply this on an imaging, then I hope this will be helpful to you.